Community and Public Health by Crystal May. Final project. Community and public health is necessary to our existence for all populations to live a safe and healthy life amongst one another. While there may be many financial, legal, and ethical issues regarding the dilemmas surrounding public health and its structure, many people depend on many of the public health services to keep them safe and healthy on many levels from harm, illness, and infectious disease. The role of community and public health in populations. Community and public health roles is to protect and improve the health of families and communities through promotion of healthy lifestyles. A large part of public health is promoting health care equity, quality, and accessibility. Public health is concerned with protecting the health of entire populations. These populations can be as small as a local neighborhood or as big as an entire country or region of the world. Public health is also responsible for the research of disease and detection, injury prevention, and control of infectious disease. Public health professionals work to limit health disparities as well as working to prevent problems from happening or reoccurring through implementing educational programs, recommending policies, administering services, and conducting research. Community health professionals focus on analyzing the effect of genetics on health, personnel choices, and the surrounding environment in order to develop programs that protect the health of your family and community. Public health organizational structure consists of three core functions: assessment of information on the health of the community, comprehensive policy development, ensuring that public health services are provided to the community. The public health system in the U.S. is made up of complex networks of people and organizations in the public and private sectors who work with varying degrees of collaboration at the national, state, and local levels to promote and protect the public's health. It is a shared effort among federal, state, and local governments to responsibly ensure conditions that allow U.S. citizens to be as healthy as possible. The legal and ethical dimensions of public and community health services. The preservation of public health is one of the most important goals of government. The enactment and enforcement of law is how the government creates the conditions for people to lead healthier and safer lives. A well-known dilemma in public health is to balance respect for individual freedom and liberty with the responsibility of governments to provide their citizens with some degree of protection in relation to health. On the ethical side, problems in public health often involves numerous risk factors, multiple stakeholders, and diverse perspectives on matters of individual liberty and population well-being. One of public health's primary aims is to achieve the greatest health benefits for the greatest number of people. It draws from a tradition of consequentialism, which judges the rightness of an action on the consequences, effects, or outcomes that are produced. The ethics of public health are concerned with the ethical dimensions of professionalism and the moral trust that society bestows on public health professionals to act for common welfare. Public health funding. According to the Trust for Americans' Health analysis, 22 states decreased their public health benefits for fiscal year 2012 to 2013 to fiscal year 2013 to 2014. Budgets in 17 states decreased for 2 or more years in a row, and budgets in 9 states decreased for 3 or more years in a row. From 2008 to 2014, the median per capita state spending decreased from $33.71 to $31.06, which represents a cut of more than $1.3 billion, which was adjusted for inflation. And according to the Affordable Care Act, There was a clear need that two initiatives to promote prevention and public health, which brought about the Prevention and Public Health Fund and the National Prevention Strategy. The Prevention and Public Health Fund is a funding source established to provide expanded and sustained federal investments to research, surveillance and tracking, and public health infrastructure, workforce, and training. The funding helps ensure that public and healthcare systems are not competing with one another, but governmental departments for scarce resources. Communication and community in public health programs. The role of public health is to effectively communicate with the public and encourage opportunities for involvement in the public health assessment process. It is important to understand the basic terminology describing the process and the overall goals and objectives of community involvement, as well as the roles of the various agency programs in the community involvement process. People who may be directly affected by an issue or incident occurring because they reside within a community of interest should have an opportunity to voice their concerns or opinions regarding decisions that may take place within their community. The community is at the heart of all public health activities, and the involvement of the community goes beyond just the communication of information. Communication strategies are needed that best meet the needs of community with culturally appropriate public health information and any other useful resources that may be helpful. According to the Institute of Medicine, a report was released with recommendations for establishing partnerships between schools of public health and related academic disciplines, along with local and state health departments and community organizations, to include public health training in medical and nursing school curricula, and increase federal funding for public health research. These are my references. Thank you.